Hello, this is Dr. Angelina with Surgicare Arts and Atlanta Body Institute and Ideal Body Institute. Today we're going to do our Thursday talk about breast augmentation. I got some questions as usual. Obviously those are very common questions. People usually ask all of that during consultation. We discuss all of those issues while you're here, but this is nice to kind of have an idea of what's going to happen once you get here. So this is kind of the issue that I like to talk about as a female, as a mom. I've been there, I've done this, I know what people go through, and I understand kind of when a woman says like, I don't want to look too fake, I still want to be able to go to my kid's school function and people not to stare at me and say stuff. This is, you know, my thing, I get it. So, why or when should somebody consider breast augmentation? Well, I think it's a personal choice. Not everybody needs it. It's really if you had either smaller breast when you were born. Some people have tuberous breast, meaning lower part of the breast is constricted, so you might have some fullness on top, but it kind of cuts off halfway through in different ways that it might look. And women feel self-conscious about it. It could be that you had kids, breastfed, breast went south, and maybe got a little flatter, and you want to restore that youthful fullness. This is a good way to restore the volume, and so implant is one of the most common ways we do it. Can you describe the process? Well, the process is a surgical process, so obviously you will see me for consultation. We discuss all the options. Usually we discuss other than your history, obviously what your wishes are, what you're trying to achieve, type of implant. There are different implants. There is silicone and saline implants, and under silicone there are different types as well. Size of it, what's going to make you happy. Would I agree with the size? I do put my, I help to measure you and kind of suggest what I think would be a better size for the implant. I prefer to do more natural looking breast rather than those kind of real big, 900cc implants. I usually remove those. I have a lot of patients who come back to remove extra large implants because now they're hurting their back. So I really try to stick to something that I would like for myself, and I help you make that decision as well. What do you expect during consultation? You come into this pretty room, you sit down here with me. We review everything from your history to your wishes to your previous surgeries or what you want to look like. We actually do little sizers and try-ons and discuss all of the things that's going to happen. It lets you basically get all information that you need to schedule your next step, which will be a preoperative visit and then surgery. Have you witnessed more changes of people going from those huge implants down to the average size? Yes, I have. As I said, I think more people right now would prefer to look more natural, and I do have a lot of people who come in now who had implants maybe 10 years ago and at the time were recommended to get those really large implants. Now they might have got older, they might have gained some weight going through menopause, they want those big implants out, they're hurting their back, and so either downsize or just doing a breast lift and removing the implants. So I actually do prefer, as I said, to go for not necessarily small implants, but something that really fits your body more natural. Where do incisions go? So incisions, there are different ways people do this. For straightforward implant without breast lift, we can do incision under the nipple or incision underneath the breast. Some people do go through the armpits. I tend not to do that, but I do like the incision under the nipple a lot because it hides so well. But I give you choice as well on that. What happens after surgery? Well, there'll be a little bit of pain, there'll be a little bit of swelling, that's normal. I would say the worst pain is probably the first 2 to 3 days, a weekend, and most people don't take any pain medicine after that, maybe a little ibuprofen once in a while. You will have several post-operative visits with me on day 1 and 1 week out, a couple weeks out, so we'll make sure everything progresses well. Appearance, first they may sit a little bit higher than I would like them to, and they usually settle down over the next few weeks. There'll be also some swelling, so they might look a little larger than they would be because of that swelling. Do you do anything particular to help with the swelling? Not really. Just standard post-operative care, so no special dressings. We give you special bra to wear after surgery. What determines whether you should, how you choose your implant versus fat transfer? Again, personal choice. Some people go by price, some people go by what they read. I help you decide by letting you feel the implants and kind of looking at you, deciding what we're trying to achieve, so we'll help you choose the right type. Fat transfer is another thing we can use for some people who don't want implants but they want to restore some of the volume. We can take fat from liposuction, let's say on the belly or wherever you got fat, and re-implant it, transfer it to the breast. Small amounts of fat can just kind of restore that cleavage area and give you a little bit of fullness there. Fullness versus volume, what patients should consider when determining if they want breast augmentation. Again, personal choice. I go for both fullness and volume. There are also different types of implants, and again we discussed that, how high they go. So there's different profile implants, high profile, ultra high profile implants. So we kind of help you choose which one would fit better. How to achieve making sure patients walk out looking natural and happy. I said size is everything, and I said I understand what women go through. I'm not going to suggest or push you into certain size that might look fake. I do consider other things like how's your clothes going to fit? Is it going to look too babaloon? But I want you to look natural, meaning when you're doing your regular tasks during the day, you can wear your bra, you can wear your shirt, you're going to look fine. When you're going out on the town, you want to put your little strapless dress on, and you're still going to look good. So you're still going to look like you got surgery as far as the fullness of the breast without looking super fake. All my surgery as usual done right here at Georgia Surgical Arts headquarters. It's in Loganville, Georgia right now. Gwinnett County, we are building one in Buckhead and one in Tampa. So we'll be all over the place. It's outpatient surgery, go home the same day, pretty well tolerated. So again, if you have any questions, write to us, comment on YouTube channel. Follow us on YouTube channel at Georgia Surgical Arts, and Instagram Surgical Arts and Georgia Surgical.